And glad as always to be joined by Dr. Ismail Mehr, the St. James anesthesiologist, the head of the COVID-19 team at St. James. Dr. Mehr, thank you for joining us today.
Good morning, and thank you for having me.
Dr. Ismail Mehr, there were two, I'm going to run down through the latest statistics here. There were two more COVID cases announced in Steuben County on Friday, both at Hornell nursing homes. On Saturday, another two more COVID cases reported, one in Hornell, one in Irwin. Then on Sunday, a case out of Prattsburg and a case out of Wheeler were announced. That brings Steuben County up to 221 positive COVID cases. Now, these numbers are way down from what they were for the Hornell-Canisteo Valley area. I think I know the answer, but I'm going to ask it anyways because it's an important question. Is it too early yet to start distancing ourselves from social distancing, to start dismissing social distancing and, hey, let's go outside? What do you think, Dr. Ismail Mehr? What's your answer?
Well, I think first and foremost, we have to follow what the governor is setting as guidelines, or actually I think it's an executive order. So we'll have an update from the governor on May 15th. With that said, from my understanding, and again, this is just my understanding of what I'm reading, is that it looks like the governor will be looking at the state in terms of regions. This has become apparent in terms of how elective surgery and hospital procedures, which are elective, are going to be resuming next week. It's being looked at by region approach. So I imagine social distancing will be looked at from a regional approach. But what I do need to make everyone understand is life is not going back to how we knew it for some time. And I've said this multiple times on different interviews that I've done. What the best case scenario, what I envision, again, this is my opinion, I foresee that there will be some measures in the near future taken to allow for certain businesses to begin opening up, but there will be some very rigid social distancing guidelines put in place for that. Also, I think that there's going to be a medium ground of social distancing. This has been an extreme that we're experiencing right now, and prior to, back in January, life was quite different. It was quite normal as we know it. We're going to be somewhere in the middle. I think it's important for people to understand. Right now, there is no cure for COVID-19. Also, there is no vaccine for it. And the numbers that you're seeing in Steuben County, 221, that's great. The numbers are on the decline in terms of daily cases being tested positive. But the result of this is because of social distancing. I think many people look at the number of only and I think it's unfortunate if we look at it as only 50,000 people have died from COVID-19. That's still 50,000 souls, 50,000 people who passed away. But that's because of social distancing. So when we try to make this analogy that, well, it wasn't as bad as we were being predicted it was, that's because we as a nation have done a fairly good job of social distancing. That number of 50,000 is because of social distancing. Imagine if there was no social distancing, how those numbers would look. So we're going to be somewhere in the middle ground for some time. I think until we have a vaccine available. There's still some questions if there's going to be immunity or not. We can discuss if you wish. But I think May 15th we'll understand a little bit more from New York State's perspective. I think the president's already put in a 3-phase approach, and if you see that by no means brings you back to life that's completely normal. So I think the answer to your question is out there from the president's task force, and I think the governor will be updating as well coming up fairly soon.
Dr. Ismail Mehr, do you have a sense of about how many COVID patients, COVID positive patients there are in the Canisteo Valley area? And I'm talking that are hospitalized or in nursing homes. Between Elderwood, Hornell Gardens, and St. James. Do you have can you guesstimate anyway?
Yeah, I don't know. I think you said, there's 221. I think the overwhelming majority, I think 80% plus is in the immediate sort of Hornellsville surrounding area in terms of number of cases. I think that was evident early on, and I think it still remains. Again, I don't have the exact percentage. I'm just throwing that number out there. But from what I can recall, hospitalizations have leveled off at St. James. We still have COVID patients being admitted. It's not as intense as it was about 3 weeks ago. Last week of March, early April, when we were seeing a lot more. So that's definitely leveling off, which is great. That doesn't mean we are returned to normal completely. Like I mentioned in the previous question, that's going to be some time. There's going to be some middle ground of how life is going to be for quite some time. I think until we can have a vaccine for this virus, because as we all know, and I've mentioned multiple times, the transmission is so fast, and the window of acceleration in terms of mild symptoms to severe symptoms is within 2 weeks, and it's significantly overburdened healthcare systems. So life is going to be sort of in between, somewhere between how it is now and how it used to be. There's definitely measures in place for social distancing, and that's what's keeping our numbers down right now.
Dr. Ismail Mehr, I was talking to a friend on Sunday, and he said he's telling people, hey, don't come to my house if somebody in your house is out in public a lot. I don't care if they've been diagnosed. If you or someone is in your household is out in public a lot and dealing with the public a lot, just assume that you could possibly be a carrier, not necessarily have it, a positive case of it, but be a carrier, and don't come to my house.
I think first and foremost, no one should be visiting anyone's house. So that's absolutely right. That's what we are in the current state is. We should not be going to visit friends. We should not be doing things like that. And if we are, we need to stop that at the moment, because absolutely asymptomatic carriers will spread it to other people. So there shouldn't be socializing in that sense right now taking place. You should remain with your immediate family, with people who live in your household, and those are people that you can have immediate contact with. And obviously, there's some contact if you're an essential worker where you're at work and whatnot. But as you can see, all those places of employment all have some significant measures in place to try to mitigate further spread from anyone who's asymptomatic. I think our community locally has done very well. Initially there was definitely some hesitancy, and you saw that. But I think when Steuben County made a public statement, and Mayor Buckley did as well, to the immediate Hornell community, and then the countywide, people started understanding and seeing that, because they could also see the numbers when you hear about people being intubated and placed on ventilators here at St. James, 2 to 3 a day in that first week. That definitely, I think, sent a message to people that this is more than they thought it was. And I think it's maintaining. I understand the cabin fever. I know everyone is getting a little tired of this. I think as our numbers are showing, there's been less cases and less community transmission. I think there will be some easing of the social distancing. I can't predict what the governor is thinking and when that plan is. But my understanding from discussions and meetings I've been in is that there will be some sort of regionalized approach. And again, it won't be back to normal as we know it. I think there'll be some middle ground for some time.
Today is Monday, April 27th. Tomorrow is Tuesday, the 28th. That's the day that this region is allowed to open up the hospital rooms for elective surgeries and treatments. How are things going with the planning for this at St. James?
So I think this is a big indicator how that Albany is looking at things from a regional approach. And I think there will be some updates on May 15th. In terms of the medical field, hospitals and medical centers across the state, what the governor has done and the Department of Health has taken a look at each county from a county basis, and there was certain criteria in terms of hospitalizations and available number of beds and other things that were factored in. And Steuben County falls in the criteria where it is acceptable for hospitals to open back up elective diagnostic testing and elective procedures, which includes surgery. For the past 7 weeks, there has been no elective surgery across the state of New York. and especially here in our county and here in our hospital. So what 7 weeks ago was an elective procedure, obviously, after 7, many of those things become much more urgent than being elective any longer. If someone's having some sort of pain or some sort of abdominal issues, some sort of hernia, that, yes, it could be put off for a little while, but it can't be put off indefinitely. So I think that's been recognized by the Department of Health that health care is essential for people. It cannot be delayed indefinitely. So we will be starting returning to elective procedures and diagnostic testing, which includes any type of, X-rays, imaging, CT scans, things like that have been delayed for some time. Also, endoscopies such as colonoscopies and upper endoscopies, and then elective surgery. That will begin on Tuesday the 28th. We have a very secure and safe plan in place. Much is not changing at the hospital in terms of visitation, in terms of entrance. Only one entry and exit point in the hospital will remain. So the hospital is not going to open up like as it was before the pandemic. One entry, one exit point. Everyone is going to be required to be masked. The universal precautions across the board will be implemented. Unfortunately, there will be no visitors allowed into the hospital. So if you're coming in for surgery, your family member will drop you off outside. You'll be brought upstairs. You'll be registered and proceed onward for your surgical procedure. And then at the end, when you're ready to go home, phone call will be made to that family member. They'll come back out front of the hospital and pick you up. Again, this is to eliminate and decrease the potential for any spread from asymptomatic carriers throughout the hospital. Also, all the COVID-19 protocol and procedures that we've put in place will remain in place. Also, anyone coming into the hospital for surgical procedures will be tested for COVID-19 3 days prior to their procedures. On 3 days prior, they will have to undergo COVID testing, which will be done here at our urgent care facility at St. James. The surgeon will give them the appropriate prescription or orders for that to be done. It'll be done 3 days prior due to, we know that viral shedding takes place 2 days after infection. So this means 3 days from the day you're tested, you'll be operated on. In the event that you were infected between those 3 days before your procedure, there is no viral shedding taking place. So we would not be putting anyone at risk. And also, we would have a COVID testing done that indicates if you're negative. If you're positive, most likely procedure would be delayed. Obviously, we'll take that into account from a case-by-case scenario, depending on what the surgery is and how serious and urgent it is. There would be some discussion taking place. So overall, we're ensuring, as we have been all along, safety for our staff, safety for our patients first and foremost, and that will remain. Again, it goes back to my previous conversation with you. We're not returning to elective surgery as routine and normal as we've known it to be. There's a middle ground here. Originally it was not occurring at all. Now we're going to start doing it, but it's not the way we've known it to be. Many measures are going to be in place to ensure distancing and mitigation of any spread, and also screening and testing so that anyone who may be positive is identified ahead of time. So hopefully the community can rest assured and feel safe. If you were scheduled for something, I encourage you to get it scheduled. Now's the time as we're going to start back up so that you can get those things taken care of so it doesn't go to the point where it's so serious that hernia now has become incarcerated or strangulated, which means that it's cutting off blood supply to the intestine or whatever, an anatomic thing that's being is causing the hernia. So it's important to move forward from that perspective.
Dr. Ismail Mehr, our guest, going to take a quick break. Stay with us.
The Ryan Agencies, your local, independent insurance agencies. The Ryan Agency employs 15 of your friends and neighbors. They live, shop, and support our community. When you buy insurance from the Ryan Agency, you support local families. Contact the Ryan Agencies today, your local source for all things insurance.
Insurance protection you can rely on. The Ryan Agency.
Back with Dr. Ismail Mehr, St. James anesthesiologist and the head of the COVID-19 team at St. James. Dr. Mayer, last week, St. James Hospital doctors, a group of them, put out a statement saying that they were finding that people were not coming to the emergency room when they should out of fear of catching COVID-19. You did a public awareness campaign, you and the other doctors at the hospital. Has that improved at all?
I'm not, as everyone knows, I don't work in the emergency department, so I'm not certain how, our numbers have been. I have seen people, as always, who have other illnesses are coming through the hospital and being seen. I think there is probably still some hesitancy in the community, and people are a little bit concerned. But absolutely, don't wait to be so sick that now you need to be hospitalized, or that you are so sick that you require further interventions that you may not have needed prior to. Always feel comfortable to call your physician, your primary care doctor, to talk to them. If they think you should come in, absolutely come on in. I can't remind everyone enough that we have separated our emergency department and our floor to COVID sides and non-COVID sides, meaning that you're completely in separated sections of the emergency department, and if you have to be admitted to the hospital, you would be so upstairs as well. There's universal precautions. Everyone's masked, as I mentioned. When you come in for surgery, you will be. I think what needs to be noted is that we've had zero hospital inpatient transfer of COVID from patient to patient, and we've only had 4 staff members who tested positive for COVID, and this was way back in week 1 when there was not social distancing guidelines in place for the state of New York. So it's very likely they contracted this from community spread, and all of them have done fine, mind you. So I think that's a testament and shows you that you're very safe coming here when our staff has been completely safe. And our patients have been too, the ones that have been here through the COVID pandemic, and we're here for non-COVID related reasons.
Dr. Ismail Mehr, immunity question. Do we know yet if you get immunity, if you get COVID-19? What's the answer there?
I think very recently, I think on Friday it was, the World Health Organization came out with a initial statement saying that they do not know. This is the first time that an official statement has come out. I believe the CDC has also come along those lines, that we just don't know if there is immunity. So the concerning part of that is that most viruses do create immunity, and usually early on. So unfortunately, we do not know that. I think that's very important, and I think that's one of the key reasons why social distancing will be modified and be somewhere in the middle ground moving forward, because we just don't know we have immunity. I know many people are like, well, I think I had it, and, I think I'm safe to go back out there. We're not sure if there's immunity right now, and there very well may not be, or very well may be. I think it was concerning to me as a physician to see that statement, because it's been being researched and looked at for quite some time now, and for them to say a statement that we're not sure yet means that it's very possible there is no long-term immunity, and that makes the pressure on the researchers and all the scientists out there to develop a vaccine far more greater.
Dr. Ismail Mehr, USA Today had a story on yesterday, and it said there are 6 new symptoms that the Center for Disease Control says could be signs of the coronavirus. Here they are: chills, repeatedly shaking with chills, muscle pain, headache, sore throat, and a loss of taste or smell. I've heard you mention some of these before, Dr. Mehr, but this loss of taste or smell, is that new to you?
No, that's been known, and we've seen patients even here in St. James have had some of that occur. I've known personal friends, healthcare providers who've had that, who've contracted COVID, that they've had a loss of smell or taste. So that is something known in the medical field. Obviously, it has to have, just because you have a loss of smell or taste does not mean you have COVID. You'll have some of the other symptoms possibly with it, but that is a known symptom. And some people have also been coming in with GI symptoms, some sort of cramping or diarrhea or nausea, vomiting type symptoms associated with one of the other COVID symptoms.
We've been talking with Dr. Ismail Mehr down to the last 60 seconds or so. Dr. Ismail Mehr, was there any final thoughts that you had, any word you want to get out to the community?
I hope everyone understands that the numbers we're seeing across our country, I think we're, nearing 1 million cases of COVID and we're over 50,000 deaths. That's in light of social distancing. So I think many people look at it and it's like, well, the estimates are supposed to be 200,000 dead or this and that. Those numbers have been kept down because we as a country, as a nation, have done a great job at social distancing. And those numbers would be exponentially greater if there wasn't social distancing. It's getting tough for everyone, myself included, to continue this. I think that moving forward soon, there will be some ease of the guidelines, but they won't go back to no guidelines at all. And we'll get through this together and, continue doing what you all are doing. And remember, we're here at St. James to take care of you 24/7, regardless if it's COVID-related or not. If you need to be seen by a doctor or physician, please come in and be seen. And if you're scheduled for surgery and you were canceled, St. James, as we mentioned, will be starting back up on the 28th under modified type of visitations and guidelines that take into account the current pandemic to ensure that everyone's safe from patients and to staff. And you get your procedure scheduled if you were delayed so that you don't come to a situation where you need to have something done emergently.
I think I speak for the entire community when I say we're very lucky to have you here at St. James. He's a great doctor, anesthesiologist, gives a lot back to the community, and I could go on and on. But really, thank you so much for all the time you give in these media appearances, your football coaching, everything you do, doctor. Thank you so much.
Thank you. It's a blessing to be home, and thank you, everyone.